This is the upper end, this is the shaft, and this is the lower end. First of all, we have to determine the side. The trochlear notch has to face anteriorly. This is the styloid process, which has to face medially. And the sharpest border, which is the interosseous border, it has to face laterally. So this is a right ulna. This is the olecranon process. It has 5 surfaces: the superior surface, the anterior surface, the medial surface, lateral surface, and the posterior surface. This is the trochlear notch. This is the coronoid process. It has 5 surfaces as well, 4 surfaces: the anterior surface, the medial surface, the lateral surface, and the superior surface. This is the supinator crest. And this is the ulnar radial notch. This is the radial notch, and this is the ulnar tuberosity. The posterior aspect of the olecranon fossa is triangular shape, and it is subcutaneous. Iske baad we have the shaft, which has 3 borders and 3 surfaces. This is the sharpest border, and it is the interosseous border, or the lateral border. This is the anterior border, and on the back we have the posterior border, which continues to the styloid process. We have 3 surfaces as well. This is the anterior surface, this is the posterior surface, and this is the medial surface. On the lower end we have a head. The head is towards the lower end, and this is the styloid process, and on the posterior aspect we have a groove between them. Muscle attachments. सबसे पहले on the olecranon process, on the superior surface towards the anterior part we have the bursa, and on the posterior part we have the triceps. उसके बाद coronoid process पे, on the medial aspect of the coronoid process we have 2 muscles, पहले flexor digitorum superficialis and then the pronator teres. On the supinator crest we have the supinator muscle. On the ulnar tuberosity, radial ulnar tuberosity, we have the brachialis muscle. This is the radial notch, which forms the proximal radio-ulnar joint between the ulna and the radius. Here surface, we have the flexor digitorum profundus muscle, which extends up to the medial surface just until the posterior border. उसके बाद anterior surface पे ही नीचे we have the pronator quadratus muscle. Posterior aspect पे हमारे पास जो border है उस पे 3 muscles का aponeurosis है. The flexor carpi ulnaris muscle, flexor carpi ulnaris, extensor carpi ulnaris, and उसके बाद flexor digitorum profundus ही. तो ये 3 का aponeurosis, और जो posterior surface है उसके ऊपर हमारे पास 3 separate muscles हैं. सबसे पहले abductor pollicis longus, extensor pollicis longus, and उसके बाद extensor indicis muscle. और जो ये ग्रूव है हमारे पास styloid process और head of lower end, इस ग्रूव के बीच में से हमारे पास टेंडन पास करे, द टेंडन ऑफ द extensor carpi ulnaris.